Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and today I am here with my very own associate who is herself a celebrity.
Oh, I mean like D minus F plus maybe level?
No, you're a celebrity with us because you have a TV show now. It's very important. And I think you're a celebrity with your parents, at least. Maybe not quite. You're not quite there yet with them.
Yeah, I don't even know if they understand
They're sort of like,
that I have a TV show.
They're like, okay.
But my aunts are a big fan.
Oh, that's good. Well, there you go. But you're on to, like, when I pull up the TLC thing, there it is, about face, and there's a picture of Dr. Rovelo, looking very, very professional and celebrity-like. And that's what we want to talk about today is celebrities having plastic surgery.
Yes, because we get that all the time. We just did that on a recent podcast. We were talking about celebrities that had plastic surgery, and everyone wants to know what they've had done because it's so obvious. And so if you are a celebrity, if you are a big name person, if you are someone that's very recognizable and on TV and on screen, this is probably the worst thing that could happen, right? Like, maybe not the worst thing, but it's what you worry about. You don't want to have a procedure done that then all of the internet is going to be talking about. And so I could see how a lot of celebrities would just choose to not have plastic surgery at all. And, I see them when I see like these actresses or whomever on TV or on the screen who really would look so great if they had a facelift. Like, they're beautiful and they look amazing. And no, not everybody needs plastic surgery. Not everyone should have it. It's a very personal choice. But it's like, oh, if I could just do a little tiny facelift on you, you would look so good. But for many reasons, these actors don't want to have plastic surgery because they don't want to look like they've had something done.
Like my practice is not like, a massive celebrity practice, but I do have a lot of celebrities that come to me and they do ask, like, how do I do it? How are you celebrity friendly? Is your practice capable of handling celebrities? And I think my practice personally is one of the best for celebrities to come to because you never hear about me or my patients in terms of who got what or who did anything.
Which is the whole point.
And I have plenty of them in there, plenty of people who are so in the public eye, but they can come in and they can pull into the building and there's no TMZ there and they can go up in the elevators and they can walk in a back door. They walk in the front door.
They walk in the front door.
They do. They come in the front door.
And nobody even cares. Like,
nope. Because there's a very different vibe in our place.
Nobody cares. Someone might look up from their phone and look at you and just look up at, it's nobody cares.
So the key is in order to do it, and I can tell you that, I'm going to put this onto the website and everything because I just have a lot more and more of these people. Like, they usually come to me for revision rhinoplasty or facelifts. That's my biggest celebrity procedures in my practice. And I think the same with you. I think you have some breast and body people.
Mine are mostly breast and body.
But you've had some face too.
Yeah.
So, but I think like in my world, it's about the revision rhinoplasties. And recently, the reason I wanted to do this is I recently had a very big name actor that everybody who's listening to this knows. And they basically came in and said, I said, well, no offense to you, but like, how did you figure out to get here? Because typically they don't get to me first. They go to multiple other people in town that are sort of named guys who do rhinoplasty or facelifts. And they go there first and then they have a problem and then they have to figure it out. And they said, well, what happened was we kept looking at all the work of these other people that we'd been referred to by our agent and our producers and all these people. Oh, I got a guy. And they would go through it and they'd say, well, and then I saw that, this didn't go well. And then Jay Calvert had to fix it. And then they will go to the next one. They said, well, it was good, but this one, blah, 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 blah. And then Jay Calvert had to fix it. And they kept saying, like, who's this Jay Calvert guy that's having to clean up all these revision rhinoplasty patients and revision faces? And they said, why don't we go there first and talk to that guy? And so when they came in, because I don't have that persona. That's not like you have to like. So the first thing for the celebrity listening to this is that,
or actually the celebrity's assistant. Let's be honest.
Let's be honest. Right, it is the assistant. That's right. That's who it is.
To them to like find the plastic surgeon.
That's right. And this is half the reason.
Yes. And so for all of the assistants out there who are going, how do I find a plastic surgeon for my employer? this is for you.
It's not a Google search.
It's not a Google. It's not a Chat GPT.
It's not. And so the thing is that...
Well, it is kind of a Google search.
Yeah,
but
it
like
is.
a real Google search, not like, you know.
But you have to dive a little
You have to
deeper.
dive.
Because the sponsored results are paid for by people who have way more money than I'll ever have.
Yeah.
And I can't pay that kind of money every month. I
There
can't.
are
I
some
wouldn't even have a
plastic
practice.
surgeons who have so much
They have oodles of cash.
oodles of money and family money, and it's not. Yeah,
No, I'm like, if there were a blue collar surgeon, then this is me. That's what I am. I look very fancy, but let's get down to brass tacks. My entire practice is about results and results only. And so with that sort of knowledge of how do you get to the person that's going to do the best for you, you have to dive deeper than just, the named guys in town. And, they do wind up here. I have there are agents that send me all their people, and I've seen, massive A-listers from several agents that are just like, no, do not play with this. That's where you go. And there are plenty of good people in town. That I'm not the only guy that can do a rhinoplasty.
Lot of great plastic surgeons
I say this all the time. In the Golden Triangle and 90210, there are really good plastic surgeons there, for sure. And we can do that podcast any day because you're going to get good surgery there. If they're there, they can't be there if they're not good. Period.
So for these poor assistants who are trying to find a good plastic surgeon, what are they supposed to look for? Like, how do they even start? Do they Google, best rhinoplasty surgeon, best tummy tuck surgeon, Beverly Hills?
I don't know. I don't pay enough money for the SEO for that stuff, so I'm not going to show up there. But you'll get to somebody.
So find a list of people. So call all your sources, whether it's referrals from the agents or from people you know, from your own personal searches, from your Chat GPT searches, and make a list of all these names. You'll probably start seeing some come up multiple times, and then go and actually do a little bit more of a deep dive into those individual names that you're finding. And, look at the reviews. Reviews are, I don't love them. But you can kind of usually see a pattern. There's always going to be a crazy person on there who's just, giving you 1 star because they don't like the pillows in your waiting room.
There should be one
I got
of those
that
at
one.
least.
And
if it's not there, you should be concerned. If a Beverly Hills plastic surgeon doesn't have a crazy person 1-star review, then something's wrong. You need to have those.
Those
They're
are out
part
there.
of it. Yeah.
But if in general the majority of them are happy patients, that's a good sign. If you're seeing a pattern of well, he was rude to me, or I had to wait 30 minutes, or he didn't, respond when I had a problem. If there's a pattern, that's of concern as well. And then always the best is to see if you can get that direct personal referral, someone who's been somewhere and is happy with it. That is truly the best. A little bit harder to do because it's kind of a closed-lipped world, and since people don't want to advertise when they've had plastic surgery. But when you move amongst those circles at that level, everybody kind of knows when someone's had something. And if you have those connections that you can actually just ask and be like, hey, who did your facelift? Then that's a good source.
Yeah, and it's very hard to tell because again, there are those of us who don't make a lot of noise. We just don't. That is all the celebs that are in my practice all say I really appreciate the amount of just totally tight-lipped secrecy that goes on, that they just don't even have to worry about it. It's discreet. It's behind the scenes, and there's no pomp and circumstance about it. We treat everybody like they're a celebrity anyway.
Everybody gets treated, they get treated well. And usually what happens is that once they've, kind of found a practice, the assistant calls, and then they usually give a pseudonym, some kind of non-real name, because they don't want to say who they are right out the gates. And so, and then the person shows up.
And some of them do.
And some of them do. So sometimes you get a fake name. Sometimes they say who they are, and be like, hey, I'm calling on behalf of so-and-so. And if that's the case, then we do try and get them in a way that's very discreet if we know who they are ahead of time. If we don't know who they are and they just show up under a fake name, same
Which
deal.
happens a lot.
You bring them in and you're discreet, and then future visits, no one's rolling out a red carpet back door entrance for you necessarily, but let us know ahead of time that you're coming and you don't want to be seen. We'll send someone down to pick you up and bring you in. It could be as quiet as it needs to be.
Yeah, and the Hollywood elite knows how to go in and out of offices without any big deal, and it's not a big deal in our part of the
Like
world.
at any given time, there's like a big black SUV sitting down in front of our building that's bringing
Several of
someone in and out of the building, and it's just everyone's everyone's used to it.
Yeah, it's not a big deal.
Yeah.
But I think that what is a big deal is getting the results that you want.
Yes, so I'm sorry. So that's what I was going to say when I was talking about how do you find your surgeon. It's like once you've gone through those reviews, go and look at the results. Like this is not where you need to care about where they are, spending their yachts and where they're going on vacation and what kind of cars they drive and how many shopping bags do they have on their picture on Rodeo Drive. Like none of that matters. None of that matters at all. Go and look at their results. If they have videos of themselves talking or explaining things, do you like how they present or do they seem like really full of themselves and obnoxious? Like, do you like the, overall aura that they're giving off as like a decent, honest human being? And do you like their results? Because at the end of the day,
that's what it is.
That's all that matters. And that's all that anybody's going to see. And how flashy they are and how cool they look doesn't mean a difference to your outcome if it's not good.
You want somebody that's going to get the job done the right way.
All that matters.
And as I always say, you'll find out how good your plastic surgeon is when things aren't right, because that's really where it counts.
Yeah.
There are complications. There are problems with plastic surgery. It's not always perfect. There's always an issue. And in reality, you want it to be the best that it possibly can be with all that, in the background. And who delivers that for you really does depend on, does this practice work for me? How is the intake process? How, who's on the team at this practice for me? Because the surgeon's busy. The surgeon does surgery. That's where, I'm, for probably 25 to 40 hours out of the week, I'm inaccessible because I'm in surgery.
You're in the OR. So the team has to take on the rest of the load, and you need them to function as well. And so you need to have a good rapport with them.
Yes.
That is so important.
So that's really the big thing is that, you can and this is why we did our episode, just because you're a billionaire, you don't have to have bad plastic surgery. Like you just because you're a celebrity, you don't have to have bad plastic surgery. You can have really good plastic surgery.
And a lot of them do. You still know about it.
You just don't know about it. I can tell you that from experience. That's why I'm always like, when they're on the red carpet, I sure would like them to give that shout out. And somebody did recently, which I thought was really cool. But that's really the thing is like you want to be in a place where you're going to get full attention. You're going to get all the bells and whistles. And like, I'll never forget, I had one celebrity patient come in, and one of the surgeons in my office like freaked out, like and totally started fangirling.
Oh no!
And I was just like, "Are you serious right now?" That surgeon has since been fired. So I was like, "You've got to be kidding me." And
that's so cringe. No,
and the star was like, it's okay. I understand. Like that happens. And I'm like, oh no, oh no, it doesn't.
That is not cool.
I was like, you've got to be kidding me. Yeah. And it was unbelievable. This is a grown ass man, and like, I'm just like, what are you doing?
Yeah,
so,
no, that's not cool.
Yeah, those people can't hang around. So my whole staff is tried and true and tested, and they're great about it. And that's what you want. You want to be totally comfortable. And not only do you just want to be comfortable with the people that are there to just take care of you, but you want to be comfortable so that everybody's like listening with their biggest ears and getting to the heart of the matter to get you the best results. Right. And I think that's really hard for celebrities sometimes. And they do tend to go to these, practices that, kind of like cater to celebrities. Mm-hmm. And I just don't know that the results are always that awesome if their concept is like, I hang out with famous people. Like I don't hang out with famous people. I hang out with patients that need great results. Whether they're famous or they're billionaires or whatever is not really interesting.
Proximity to famous people does not equate to a good surgical result.
No, it doesn't. And there are practices that are really like very celebrity heavy, and they almost make it like if you're not going there, like what's wrong with you? And I just don't think that that's true in terms of some of the operations that need to really be done at a high level.
Right. Yeah, I think that's a good wrap up for the assistants.
Yeah, because it's the assistants that are listening. We know we're trying to help, but go the next level. Don't just say, oh, I found somebody. This guy's really famous and he's going to be great. Right. Find somebody that's going to get the killer results.
Yeah,
that's what it is.
That's all that matters. That's literally all that matters.
Look at those results, man. It is all about that, and If you can see over and over lots and lots of great results, and that's where you go. Try that out. And you should do 2 or 3 consultations, obviously, but it's there is a group of plastic surgeons that are really good at these things, and you got to find them.
Couldn't agree more.
Well then, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.